Hi, this is Tina Garrity. Today I will be reviewing Independence Blue Cross's Keystone 65 Basic HMO for 2026. The Keystone Basic HMO continues to be available in all 5 counties of Philadelphia with a zero premium per month. It also continues to have no deductibles attached to it, no medical deductibles or prescription drug deductibles. The primary care physician is a zero copay. Specialist is currently a $38 copay. Just as a reminder, on this product, it is not necessary to get a referral to see a specialist. You can go directly to a participating specialist without a referral. For outpatient surgery that uses the surgery center, you will pay a $225 copay. At the hospital for the same service, you will pay $355 copay. $115 at the emergency room. It is not waived if admitted as an inpatient. For outpatient diagnostic radiology services, X-rays are $40. Something like CAT scans or MRIs are a $225 copay. Lab work continues to be a $0 copay as long as you use the lab that your primary care physician directs you to use, which is usually LabCorp. They are a participating lab with Independence Blue Cross. If admitted as an inpatient, you will pay a $325 copay per day up to 7 days. 8 days going forward, should you have a long hospital stay, you will not pay any more copays, which means that for a long hospital stay, the most you would ever pay per admission is $2,275. Physical therapy, occupational therapy, and speech therapy continue to be a $25 copay on this plan. The over-the-counter allowance is $60 per quarter, and the maximum out-of-pocket is $8,500 per calendar year, which means that should your medical costs exceed this, everything after the $8,500 would be at a zero copay as long as it is a Medicare approved benefit. Keep in mind that with an HMO, you need to continue to stay in the network. However, you do have worldwide emergency urgent care coverage on this plan. Let's move over to the prescription drug benefits. Prescription drug benefits are included on this plan with no Part D deductible. Tier 1 and Tier 2 medications are available at a preferred pharmacy for a zero copay. Tier 3 medications are a 25% coinsurance. Tier 4, 42%. Tier 5, 33%. Insulin continues to be covered at a $35 copay per month. Keep in mind that in 2026, the annual maximum of out-of-pocket costs for prescription drugs is maxed out at $2,100. So after reaching the $2,100, you pay zero for any covered drugs beyond that point. Let's talk about dental, vision, and hearing. Dental, vision, and hearing continues to be covered in this plan. If you go to an in-network Independence Blue Cross provider, you will continue to get 2 cleanings, one every 6 months at zero copay, fluoride treatment, and 2 dental consultations every 12 months at zero copay, a set of bite wing x-rays every year at a zero copay, and every 3 years panoramic x-rays at a zero copay. In addition to that, you will have $2,000 in-network annual allowance to be used on comprehensive coverage. Comprehensive coverage includes things like fillings, root canals, crowns, extractions, dentures, implants, partials, and oral surgery. You will only pay 10% of the coinsurance up to $2,000. The company will cover 90%. Routine vision care is also included in this plan, and Independence uses the Davis Vision Network. which includes a zero copay at a Davis provider for a routine eye exam every year. Eyewear purchased from Davis Vision Collection covered in full. The eyewear purchased at VisionWorks is a $250 allowance, and the eyewear purchased at a Davis Vision Network provider outside the Davis Vision Collection is a $150 allowance per year. Contact lenses can be substituted instead of eyewear with a $150 allowance. True Hearing is Independence Blue Cross's hearing network. You qualify for a zero copay for a routine hearing exam, one per year, hearing aid fittings and evaluations, unlimited for the first year, and you can purchase hearing aids, up to 2 hearing aids every year, 1 hearing aid per year, $6.99 copay or $9.99 copay. The over-the-counter allowance can be used at retailers like CVS and Walgreens and Walmart and Dollar General. You can also use it online, or you can use it over the phone. It is a use it or lose it benefit. Remember, every 3 months, you will have $60 to spend. Telehealth is also available through Teladoc at a zero copay. Independence allows you to earn $250 in gift cards from popular retailers for things like annual wellness visit participation or getting your mammogram or your flu shot. The One Pass Fitness membership continues to be included in the plan, which means you get a basic gym membership at no cost to you with participating facilities. Transportation is available. If you are diagnosed with diabetes and congestive heart failure, you are eligible for a small transportation benefit. Food and produce benefit is available for those diagnosed with both diabetes and depressive disorders. This is a brief overview of the Keystone 65 Basic HMO. If you are interested in the plan, please reach out to me and I'd be happy to help you check your doctors, your medications, and also enroll in the plan. Have a great day.